Do you ever notice one arm or leg staying swollen for months or even years, like it just won't go back to normal? Maybe after a surgery or illness. That could be lymphedema, and while it's annoying on its own, in rare cases, it can hide something dangerous underneath, a cancer called Stewart-Treves Syndrome. Think of it like rust growing slowly inside a pipe. It starts silently. This condition is when a rare cancer, called Lymphangiosarcoma, grows in areas with long-term lymphedema, usually after someone has had breast cancer surgery involving lymph node removal. It's rare but serious. Have you or someone you know had swelling after cancer treatment? It's important to keep an eye on those changes. Imagine your body's drainage system, like gutters on a house, gets blocked. The fluid called lymph can't flow properly, so swelling happens. This is lymphedema. When this swelling lasts for years, often 5 to 10 years after a mastectomy or lymph node removal, the body's tissues are under constant stress. Over time, the blood vessels in the skin can grow abnormally and turn cancerous. It's like a garden hose left in the sun too long. The material weakens and cracks. The main cause, long-standing lymphedema, often after cancer treatments. It's not something that happens quickly, and it's not contagious. Your body is just struggling to heal over many years. How do you know if something is wrong? At first, it might look like harmless bruising or a small bluish-red bump on the swollen arm, like a weird mark you cannot explain. But here is the red flag: the spot does not heal. It grows. Maybe it starts bleeding slightly when rubbed. You might see multiple spots appearing, almost like a rash, but it is actually cancer. Think of it like moss spreading on a wet wall, starts small, but keeps growing. Pain might not come at first, but as it spreads, the area can feel tender or heavy. If you have had lymphedema for years and see new strange skin changes, do not ignore it. Ask, is this new? Is it changing? That is your cue to see a doctor. First, they will ask about your medical history. Have you had cancer surgery or long-term swelling? Then comes a physical examination. But the real clue comes from a biopsy, where they take a tiny piece of the unusual skin patch and look at it under a microscope. It is like sending a photo to an expert to figure out what kind of plant it is. Scans like MRI or CT might show how deep the problem goes. Once confirmed, treatment usually means surgery to remove the tumor, sometimes even amputation if it is advanced. Radiation or chemotherapy might help too, but it is tough. Early detection is everything. Catch it early, and you might only need a small surgery. Wait too long, and choices get harder. You can't always stop it, but you can reduce the risk. Think of it like car maintenance. Regular checkups keep things running smoothly. If you have lymphedema, wear compression sleeves, avoid injuries to the swollen arm, and keep the skin clean and moisturized. No cuts, no burns, no heavy lifting. Your goal is to protect that limb. Physical therapists can teach special massage and exercises to help drainage. And most importantly, check your skin every week. Use the mirror. Take photos. Track changes. Prevention is about daily care and never ignoring what seems a little off. It's not fear, it's being smart. Scientists are working hard to find better ways to catch and stop this rare cancer earlier. New research is looking at special imaging tools that highlight abnormal blood vessels before they turn into tumors. Some labs are studying tiny clues in the blood called biomarkers that might warn of cancer before it shows up on the skin. Others are testing targeted therapies, medicines that attack only cancer cells without harming healthy ones. Imagine a smart missile instead of a bomb. There's also focus on improving lymphedema care to reduce long-term damage. While cures aren't here, yet awareness and early tech are giving hope. If you're part of a cancer survivor group, ask if there are new studies near you. You might help and benefit too.